Hi there, welcome to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're going to talk about early preventative orthodontic treatment, and in particular we're going to talk about the early correction of deep overbites. We're going to talk about Quiva, who presented to my office for assessment and treatment at about 8 years of age in the mixed dentition. The mixed dentition is that time when patients have a mixture of adult teeth both at the front and at the back, while they still have baby teeth in the middle with the adult teeth developing underneath the gums. Quiva had a number of issues, including a deep incisor overbite at the front. This means that there's an increase in the vertical overlap of the incisor teeth, which has a very negative effect on the growth and development of the remainder of her teeth, as well as her jaws, as she continues to grow and develop into her teenage and adult years. And in the long term, it has a very negative effect on your long-term dental health and function. So the early correction of Quiva's deep overbite started at 8 years of age, first of all with the use of a mixed dentition expander. Mixed dentition expander is a very simple device. As you can see in the photographs, it's attached to her adult molar teeth at the back, as well as being attached to some of the baby molar teeth in the middle. The appliance is fixed in so that Quiva and her mom, they don't need to worry about removing it. And then Quiva's mom makes one very small adjustment of the expander every night for between 4 to 5 weeks. These adjustments are no more than 1/4 millimeter, and there's no discomfort because we do it slowly over 4 to 5 weeks. Once the expansion has completed, it now provides us with much more room for the alignment of the teeth, and the correction of the deep overbite commences with the use of what we call a 2x4 or sectional brace or orthodontic appliance. It's called a 2x4 appliance because it's attached to the adult teeth at the front, the 4 adult teeth at the front, as well as the 2 adult molar teeth at the back. This 2x4 appliance allows us to lift up or intrude the upper 4 incisors, repositioning them in a way that allows for the correction of the deep overbite. This takes no more than about 6 to 9 months, and once it has been corrected, it now allows the lower jaw to start to grow forward and catch up with the upper jaw, which further helps with the correction of the deep overbite. At the end of this early orthodontic treatment, or early preventative orthodontic treatment, we then remove Quiva's 2x4 or sectional appliance, and then we fit her with a specialized type of nighttime retainer. This retainer is called a Hawley retainer, and it's specific because it has what we describe as a biplane. The biplane maintains the teeth in the new alignment, and it also allows for the maintenance of the overbite correction. This happens because when the biplane is in position in bed at night, it allows for the correct contact with the lower front or the lower incisor teeth. There's a separation at the back which allows the lower molar teeth to continue to grow or erupt into position, and this is how the biplane allows for the maintenance of the overbite correction from the end of the initial phase of orthodontic treatment, as the remainder of the adult teeth continue to grow into position, which has happened by 12.5 to 13 years of age. During this time, we review Quiva every 6 months to make sure that the teeth are growing into the correct position and alignment.